Chronic kidney disease refers to a condition which affects the kidneys over a long period of time, and when not managed appropriately, can lead to kidney failure. Globally, about 1 out of every 10 people has chronic kidney disease. In Ghana, the situation is even higher, with about 13 out of every 100 people having chronic kidney disease. This means about 4 million people in Ghana have chronic kidney disease. If you count 10 people around you now, at least one of you has chronic kidney disease. The trend is even more worrying as more young people are found to have the disease in sub-Saharan Africa. Evidence from the teaching hospitals show that the average age of patients with chronic kidney disease is 48 years in Ghana. This is a far lower age compared to high-income countries where the average age is over 60 years. Most people, unfortunately, are not aware of chronic kidney disease and therefore seek treatment very late. Research done at the Komfo Teaching Hospital shows that over 70% of patients report with kidney failure, and when dialysis is required, most cannot afford treatment. Up to 50% of patients who report with kidney disease will therefore die on admission. Chronic kidney disease is constantly one of the top 5 killers on the medical ward at the Komfo Teaching Hospital. After all the training I underwent to help people with kidney disease, I was so helpless as I watched the young, old, male, female die from kidney disease every day. I was just tired of signing death certificates instead of treating people to get better. I could not continue the status quo anymore and decided to get out of the consulting room and the ward to engage in public education and advocacy in order to prevent this gruesome phenomenon. Most of the patients coming to see me with kidney failure have no idea how they got the disease and how to prevent it. They were therefore using some forms of treatment which was potentially worsening the kidney damage. Only a few patients are able to afford some form of dialysis. In Ghana, the most common causes of kidney disease are hypertension, diabetes, the use of some herbal medications, prolonged use of painkillers, just to name a few. Most come so late that we are unable to ascertain the cause of their kidney disease. I dedicate this book to one of my patients, Mr. Samuel Ayeba Kofi. He was diagnosed with hypertension which was not controlled. His kidney function, unfortunately, was not checked until he developed swollen feet, was diagnosed with kidney failure and referred.
My name is Samuel Ayeba Kofi. I'm 48 years of age. I'm having a dialysis section or treatment, and this is to help me live my life better, because within my system or within my blood there are a lot of things that are waste or fluids that have to be taken out of my body for me to live. That is why I'm on the dialysis machine.
Our investigations confirmed he had kidney failure and needed dialysis to survive. He was in denial for a long time since he believed he was fine and could not have had kidney failure. He had to be admitted with complications on about 2 occasions before he subsequently started dialysis. Mr. Ayeba Kofi was on dialysis for about 3 years seeking funds for a kidney transplant as his brother was ready to donate to him. To prevent such late cases of kidney disease and decrease the high death rate, I set out on a personal campaign and later invited colleagues and volunteers to reach out to the next healthy person to ensure that they do not get kidney disease in the first place. This drive led to the formation of Kidney Consult, which is an organization with a vision to promote healthy kidneys in Ghana and beyond. Our mission is to prevent kidney disease in those without, help prevent worsening in those with kidney disease, as well as aid in expert management in those with kidney failure. Our campaign has 5 key objectives. 1. To advocate for the inclusion of treatment of kidney failure on the National Health Insurance Scheme in collaboration with the Ghana Kidney Association. 2. To educate the populace on how to prevent kidney disease on social media, radio, TV, churches, and organized groups, as well as taking advantage of the World Kidney Day, World Hypertension Day, and World Diabetes Day to educate, as these are the major causes of kidney disease worldwide and in Ghana. 3. To educate healthcare providers on how to prevent, screen early, manage, and refer cases appropriately when needed. 4. To organize free health screening with support from some partners, such as the Enyidado Foundation, Ghana Kidney Association, Adom Rosso Cold Store, Keep the Faith Enterprise, Dali D Enterprise, Keen Health, Makita Company Limited. And we continue to require support for our exercises that help us to screen those who are unable to afford for free. And 5, to conduct research to advance our knowledge on kidney disease in Ghana. We have chalked some successes, but there's still work to be done, and that is why we need your support. Mr. Samuel Ayeba Kofi, a real soldier in our campaigns and someone who never hesitated to tell his story on radio and during our free screening campaigns, however, died on the 14th of April this year. May his good and caring soul rest in perfect peace. You can also help support to prevent the next person from getting kidney disease. We have the men and women, and we require your support to do this. We have so far, in just over 3 years, visited over 30 churches, mainly in the Ashanti region, the Greater Accra region, and also conducted online meetings for organized groups in the US and in the UK, namely the Pentecost Men's Ministry in Telford. We have visited 8 television stations and presented on the Vodafone Healthline program, which was aired on many television stations last year. There have been visits to 13 radio stations on multiple locations to educate on kidney disease prevention. We have visited organized groups such as the Queen Mothers Association of Ashanti Region, Accountants Association in the Ashanti Region, and the MOBA 97-year group in the US. And that is through virtual interaction in educating about kidney disease. We have organized free kidney health screening in conjunction with the Enyidado Foundation and the Ghana Kidney Foundation for consistently over the period. We have reached over 2,000 people with free kidney screening in 4 years, and over 9,000 for hypertension screening in conjunction with the International Society of Hypertension, with over 300 volunteers during the May measurement month over a period of 2 years. We aim to screen over 10,000 people this year, but it was cancelled as a result of the COVID-19 pandemic. We have also trained and set up a renal management team at the Menchia District Hospital, Kumasi South Hospital, the Tafo Government Hospital, and the Kokofu Government Hospital, all in the Ashanti region. We have plans to reach out to all peripheral hospitals in the Ashanti region and other regions as well with your support. Take note that kidney disease is common in Ghana. It's without symptoms, and in most cases may creep up on you without you being aware. Have you ever had your kidney functions checked? Do you have hypertension or diabetes? Or have anyone in your family with these diseases? Are you black? Are you older than 30 years? If you answered yes to any of these questions, you may be at risk of kidney disease. Kidney Consult has now registered officially as an NGO called the Kidney Health International to also help solve this problem. This NGO is looking for support to also help the vulnerable with chronic kidney disease. Your generous donation will help us reach many people to help them prevent kidney disease, support those with kidney failure who cannot afford their treatment. We need your help to break more grounds, and this book being launched today is the first of many to come to educate the populace about kidney disease prevention and raise funds for Kidney Health International. God bless you bountifully as you give to support this worthy cause. Thank you.
Mwana you wakula